Ninkamo Yada Eradiase and then a second day a Health Week celebration. Yeah, shall say Enra. Meaning say Presbyterian churches in the shall say Monday. Yeah, shall say Enra Wednesday. Enra ye kasafa lifestyle diseases home. And then so Erade aye adom yen. Ache yen. O doctor kese pehine baako wakwadare mu wo akoma mu won wutumi papa yakoma no anhwe mu no yare afuma san akata so or your head of cardiological department at University of Ghana Medical Center sanso and or your medical consultant into your friend or Dr. Bafu Jan your fan sembo kese pa nhia Dr. Kwan Abrobe. Oh, somebody sir. Doc Akaba.
Chino a wedding crabet. Ever modern. The Edicano Meda organizers Nasi for this invitation. Most of the time, say, Omkase, Yameka about health, at least, yeah, not churches in the first place. I didn't say because as of now, lately, you see a lot of miracles in Nema. Say, I sorry be frame say, and at least, man, say, okay, yes, you may, you know, if you doing say, Yankopon day. Yes, my topic say, Yameka about cardiac arrest. And cardiac arrest no minim say amanfo nim adekra say wakoma onama na akoma no ejai adwumaye birim pese hu say eno sa na sia ade bi na wo na unim ana say just all of a sudden no wakoma no ejai adwumaye obi be say Nyankopon boy no o catch say one day obesan frey enti asa yenyi no na akoma no a ekita emu no ono so a start break kakra enti ayese obi be say ayese kane bia yedum ne kakra enti ebedu ba bi no na tamaso enti yade no bi wo ho a ya na ede bae ho so yenyina ase Nyankopon man say ebedi bia 100 years na because of that no unya hypertension at the age of 18 na me sure say we do 100 no because a beti una no so say we cholesterol and now we sugar was ra and no so teso we say we kesi too much so and no so eteso na omo mbedum nsa ne omo mbedum cigarette omo so no ma ebeteso nti yem say Nyankopon boy no onim say obia ne nade ono a onim da odbefro but at times ye na ya ye pentem ene nneema bi wo ho a ye be ya na ama ye nano eswati inti den bema wakoma all of a sudden eje adwumaye wonnim ho hwe wonnim mobeti obi around 35 or 40 years onama otito ye eno anu no at times ye nim omo life nema actually omo ye because ye wo bibi ye friend risk factors enema bi wo ho a oya ebema wakoma yade and yem say mu bebre yenim say o edidie mu say ye didie mu Ghana ha ye didie ya obi be say ya fine pa because abrofo no ba ha muti o manage aduane no ho because say aduane na edie etimi di bebre obi obi say o ko tena brochi a emo no ye tiama wa ye measure o cap kitwa bi mu ne de two plates so hu aduane na atim say aduane we na yesese nwura bi egu ho I was Nanka Ghana Pana Mona ya wo me fufu bi na de kwan bi na nami ende say aponchio say dwan yo ne de nyina guso ama me enti e ba say ye dwan ni mudie no eno e hayen e ma be break me nya hypertension no so asema wo ho no say unyanya e den se beko die enti e den se beko no say Nyankopon no a oboye no o man ye be 25 mechanisms I wo body nimu se be yanke be control u BP na ma Inti se wote se atia fa so, that means all these mechanisms have failed. Inti apart from enura doctors de be ma ono ene be ma na akofom na akoma no so ye muscle enam adwuma oye no ema akoma no muscle no ye very thick sa so a obi besie moja na nyankopon boy ya e de kɔ akoma no mu ebi meka ho the same thing. Inti imagine say akoma no ye bɔ na akoma no sha ya ma wo so ne wakoma na wakoye adwuma bi ama akoma no muscle na be so thick say moja na ekɔ akoma mu no enye sufficient eno sa wo na ma akoma no betima stop wonnim ho hwe akoma na betimi ayese wabre na akoma no so de obre a obi say ye hia at least the first 24 hours so obi be ye bibi ama akoma na san ahye ase bio ye adwuma no se me ye operation a se me ma akoma no eja ye adwuma ye nti wo stop akoma no ye wo at least 3 hours a ye betima stop akoma na ye ho adwuma na ewia na ya san ma na back nti sa 3 hours no ye imagine say wo de ne happen ye no na wo wa bontin tama ye do beto taxi mu abedu hospital no obedu na time na twem ye gina ho no kra na 3 hours no say ya nya abro so pe na ye ho hyehye because enye twem pe edin se obesan nya na akoma no nti say ye kɔ na ye operation na 3 hours na se ye ntimi nya na akoma de na wo de besi ofie no edin nti ye de ne se nka benya obi anim ne risk obia wudi 35 years and above nke say every year yetimi check wakoma hwe say akoma no oye fine ana onye fine ye mu bebre ye cars 6 months bia ye ko maintenance be body na nyankopon de ma ye no from tama ya wo ye no si enyare ya ye nko ba bia ye mu bia ni ho ebeko che o se wo yare ansa that means tama wo be yare no na akoma no wa exhaust ni reserve ni nyina asa into ubedru ho no doctors na at least you better try say the betima ye there times me bisa say mo ba doctor ho kra then na mo hwehwe ye the betima ne say betima ma ya de na wo no senka say in 5 years time na nyankopon be frɛ wa ye pe say nye bi 10 years nye say ya de no na be ma na akokra because nyankopon bo ne ma say sa o ya de no ni nyina say wa twen ama na say ansa na obehu doctors inti se onya bedru ho sa time na de betima ya boa wan se be mo aduru a ebe ma wako wanim kakra obi be sie se wo BP a na wan num aduru a minim se in 5 years time no bebre betima nya stroke a wo num aduru bia inti minim scientist wo BP a se me mo aduru na se 5 years time no wo de unya stroke because onum aduru but unfortunately bebre mpe ya aduru no so what the mom minim de ba o mutimi traka mu na obi a onko school da etimi hwe o monim a na wa convince o mo na ya ko school be how many years ye ka kra na ye nte ase obehu na ye de edru na to baby na yakofa edro bi a ye nim ni din na ye se wo de tu yim na unom 1 cup anopa 1 cup anwumre unnim edro no de ye but because wo traka no mu a ya convince you no wato edro na ye betima chiro de ye no o de ato baby na ofa ada edro eno san enche oba na akoma na stop here doctor no hwe was say na nke say edro na no mu was it be ye gya ye say edro no na ye mu bebre eno na ye inti akoma no be stop here because structurally there's something wrong inside the heart unim and unim because unko hospital that see and check you. And think my advice is say obi a wedi 35 and above. At least call clinic na yen check you BP. Na hu se BP na fine. Ko na yen twu moja na yen se moja na fine. Cholesterol bia nim, kidney no ye adwuma fine. Utimi yes ade no there. At least ubetime nyi akosi mfie a onyankopon hwehwe de ma ho. Besi ya anya sa na ye twen se ye be yare anse na ekohu doctor de edru ha ya na edin. Edru hwa na edin inti se yebetima ye bibi aboa ye ho a first thing is say yebe try say at least say BP na ye wo say sitwe yade na yewo say cholesterol na yewo to yen doctors no enye yade wo BP enye yade BP no de yade foforo beba na saa yade no de eba yentimi nye ho hwe be BP no de enye yade after all BP na akosoro ye wadura de beba fo nti dem bio enhye da nti man kan tro bi say o me BP me yare da bi wo BP a to yen doctors no enye yade ye wadura ebema BP na ba fo the only thing is ese onum say aduru no wo sugar enhye da nye yade eye insulin na wonni bi na ye bema obi nti de nya wo de na wonni no untimi produce ni ye bema equally insulin a nipa de ni bi na de amount na de awo pane be so ubetima wo pane ne nko ade anka sugar enye yade ma be unfortunately nyina na betima wo pane no saa na wo cholesterol wo soro a nye nyina na betima gye aduane na de no di aduane na ya chi no saa obi be si Ghana ha yesi zomi engu koko ye very good red oil that's very good but unfortunately the way we extract our oil make it not so good ye use heat se mo shop na moto anwa on how it heating 2 or 3 times we won't say na started that now you're very thick. That is how cholesterol is formed. Any oil extracted without heat, there's no cholesterol. Ndu bako akoto oil no shop and you say oh zero cholesterol, yeah. But we didn't know 2-3 times per one kasa will produce cholesterol because it's a heat. Enti engo koko the best oil in the world. But unfortunately, ye way na ye timidly producing ama ensheda nyesa. Into the worst part of red oil, and na yeso and the pano, the friend is zooming. That thick one, that is actually most of the time a cholesterol content. Na cholesterol ya angwabia ebeda intinimu a ema muja nya kwan mfa ho. Nti eno ne ma amanfo nya omu stroke. Eno ane be ma wanya heart attack. Eno ane be ma wanya kidney problem. The same cholesterol. Inti yebetima avoid ya nka yentimine entiso obi be say titino na nka abenkwan ne nka tekwan de ne di ne Easter bread ne brunya bread be say one hwe ya ebinum every day ombetima di nka tekwan anopa awie ne anwumre and that oil alone is not good for the body. That's why it's a nice food, is not good for the body. Inti de ma yakuma so nam hwa akuma no betima stop it all of a sudden. There are things going on, possibly you've never noticed. A very few occasions say you will be at nakuma no shenya kumane da na no stop it. Scientifically iniho. Most of the time, so wakuma ejaya juma ya ye nim. Say bibi wo ho a na wunnim intina akuma ni jaye. Ye free bibi palpitations. You just say a man for that's the common thing that obia a complaint. Oh, makuma mo na kuma no e wo so me. Yeah, palpitation is one of the indications say akuma no problem. At times it me count how many palpitations na wunya in a day. That tells how severe. Yenyina once in a while you benya palpitation. Obi shewa bufu akuma no bobo sisi ya. Once in a while, but what every day by 2 or 3 times which means akuma no ko America wa ultimate. That means there's a problem with the heart. You need to see the heart doctors. Unfortunately, doctors in the dorsal, they say herbal for almost all my doctors. Into doctors in the dorsal, and once I walk to hospital, so you doctor. Actually, your doctor almost specialty is almost akumape. Into sakuma yade na wa me pacho okwa hwehwe doctor ohwe akuma. Se kidney na wa hwehwe doctor ohwe kidney. As at now, you need doctor ohwe ni nyina. Omu ni ho. So bisame you need doctor otimi hwe bibia because obi say metima ye akuma ho surgery. Metima ko pam akuma minim ha akuma ne tie ye be yi ato ho ya ohoro ho na azanda to e betima ye ni nyina a nipa no be mintimi operate obi ani. Eni no enye media. Nti wo ka kyerem se min kotwa obi min kokra enye media. Tu ba na ka se wani yo ya me ka kyerem se mpacho doctor for ne deɛ no. But unfortunately, Ghana yenisa obi adwen say obi a doctor. Unya duru hodre obi a oshata de fufu a ode ayi bi ato ne kom bi a doctor. Nye nyina na ye sa doctor no. Nti se wokɔ na wo akomayade a na obi say doctor na ɔhwɛ akoma no ɔwɛn. Because one yes sir, ubekwa ko hu doctor si ya ye dɔso. Ubehu obi obema oduro. Yeah, aduro no say aduro no ebema obi pina kɔfom ana ema ne nkɔfom. Ɛno so yasɛm. Unfortunately, yenro ewo market in a dɔso. Enro no dɔso. Enro no it market say dɔso. Unfortunately, se won hu doctor onim enro no a ontimi ma aduro a o wakoma no ehiama no. Because nye obia BP na ye the same. Obi there because ni BP no different. Inti aduro we na ese emma no ni BP no beko fom. Nye say oh me kunu no aduro we for ni BP inti me so metima no aduro there be enye sa. Nyankopon boy no obia wo ne de. Inti aduro we be no ma ebe sane ade no wan hwe ya wo no ma ensa o yare. Inti se okotra ka mu na obi be ka se oh aduro we de agibi bia asad now you need a draw back on AGBBR because kidney ne function is different from the heart. Inti a draw bit massa kidney here no ain't me affect the heart no because heart need a different structure. Sana a draw besa uti yade no any kidney no any share because baby or no bekono any baby kidney no into kotna kem ne ka just a draw back on we ye we nyina mpacho me nye sure. Almost say a habine, a rare, natural. Yes, yet almost say. And a presentation and a me na nka no you bet mama all the list of all the herbal medicine are available. But unfortunately, omunyina you need one evidence omuye juma. The same thing about vitamins. You say call hospital obi a vitamin B. There's no any evidence. I want no vitamin increase your life and wow. So we did very well. Young say, obi be say poor food, and yet I'm but we did in Ghana see a kadriane and kaye gooda. We be say a bankuni okro or na okro stew because of the green leaves and the carbohydrate, and no money a more balanced diet. Sing ye nuane na ye woni nyina but no nje say no so kire say bankunu be di be 3 or 4 there be aha nti say e can balance diet nka enumum e balancing most of the food that ye di wa ha nti na ye topic of cardiac arrest or heart arrest ana akumana wo ho na ejailo is because there's something inside the heart. You haven't taken the chance to go and look for it. Inti se obi wo ha no edi more than 35 years. No on call hospital da me pacho. We dey call no man check it. At least BP any sugar amount. Because at times churches more clinic nkiti binka ya pon sorry na nurse biti ho na wa check we bi BP amaye na hu baby a obi a BP wo na at least from there e bet match say okay. We the BP no was on numadru from there because BP no amount adibiao e will be say amount so be a BP the only thing a bit my yarn say utibe yoya. That's all BP. Even BP 200 omunam ho hwenye omo nti ubehu no na nipe otofom na kuma ni gyae adwuma ya because akuma na bre because opompe with that pressure is too much. Yes, say your pressure ni nyina ye maximum 140. Now the 200. Now constantly akumani push 200 that. Odu baby obejira. No gina no the cardiac arrest no say akumano wa bre no we gina. That's all. And unfortunately akumani gina for 5 minutes. Na ye nyo obi push you. Akumano na asansha ase biwa. But 5 minutes time na brain no there oko. Because obia mani moja no obia mani moja that means tamaso inti enne kasa me yeso se me gina ha me kasa bebre but me jai nanka so obi wo ho no obi bi opese explain manual na afi wo bisa question na ahwe ahwe how metimi aboa. Thank you.
Yeah, about that, in Chechakra. Say, you can't akuma ho asem. Na, Bribia no, you can say, aswata, and say, idea, you, and your my. Tin person who say, aswata, Yemaya, and I say, and your makuma.
I sort of, Obi say, body no. At times they do high say can say nipa okreti nipa your body way say nyankopon a science for you because a nature but say nyankopon a boy that person is so complex. Is the human body is one of the complex thing you can think of. Ensure before ensure no be drew yefunu na atake the temperature of the body. Inti say obenum eye shorter nebe ha akoma no enhyeda nyesa. But the only thing they bit my heart, man, is say, what baby a she. Now, all of a sudden, what change? I could be a new. There was some mechanism be a friend of vasodilatation. Say, Akumano, who a Riemu, now be a share. Vessels no be. Uko be a new, a close up. Intisa in so new and a ma at times. Say, Basana, a Makumano, vessels no close up. Just all of a sudden, and no me just say and take it too long. Say take it too long, yes, a bit more affected akumano. But you hope say most of the time, say a glass of ice water na onum. By the time I show no yefum no, na take it the body's temperature. Obi say aduane e hye wo de to anuma, yes heat no ne duru yefum. Enru ho no na asesa. Because there's a mechanism in the path that will control the body temperature. And sana inti ebedru hono na adwo enye so ice inti yenhada nka se ice water enye mawo ana eye mawo be eye obi ane na ebinum num ice water de eye ne se etrawo mu the ma ice water trawo no se mini ade na efre esophagus a movie obi be se nipadua no eye part of almost every organ in the world. Every animal has a part in a human being. Why we are so complex, or God created is so complex, we don't understand. But we have a part of every animal in this creature, in earth, in us. So as we say, the esophagus and the intestine moves like a snake. That's how it moves. So the moment you swallow and the muzzle doesn't open up, you will choke. So true, this is when baby now sweating so hot. All of a sudden, in less than seconds, you person changing the whole body temperature. It will not work. The body needs some time to slow down before it changes the temperature, and that time will make the water go the wrong side. Until you ensure a new why baby I would never be able to sweat by no other friends you knew. No, we started and ensure the wrong place. Because you did not give the body a chance to adjust with the temperature. Until enye ensure no enye. The way I will take ensure no and the money is harmful to the body. But ensure there, ice water will be to anytime. Open warm water will be to anytime. The body will adjust the temperature. Just give it that seconds. Baby, no fear or sweating or take care. No, won't mean any sir. Money time kakra. Until ensure no problem. It will not affect your heart. Thank you.
Dog Pastor, my question here. Aben kwino. Me pacho say o advice here. Aben kwine katin kwindi no. Obeche say yendi ni sen like you say me fie na aben kwino.
Eh debia.
Eyedin. It is na watch no yendi ni sen boso me like so say who regulate here because see I go so connect aben kwine babe. Inti ye duanga I am a chrome aduanity. You buy anything. What?
In the rest sense, you see, too much of everything is bad, isn't it? So that's a common thing. Too much of everything is bad. It is a wow bit my regulate here. Would the bank 1 week or cholesterol because that one I can prove it to you. And the lab near test near. But a bit more problem in the way I want body no more body metabolize it. How the body uses the oil. Into a bit more problem than that. Into the anwaki every crown or cholesterol because they have genetically they have a problem with how they use their cholesterol. Into say who was a busuanumua? We say who did a 1 day crown in a year or cholesterol because ne binum so the baby I say mono the area motininti baby and one amuti debia anti. Possibly the body has adapted to your metabolism. Inti a bit mabase. But the best way to know is to check. Cholesterol test, 15 series, 20 series, and cost to be brave. And once I call, yeah, simple. Yeah, check out. NASA, no one who say, oh, cholesterol, no one need. I would need be a bet your level. Yet your level, no one who say, oh, level, almost to the borderline. Now one casawa advice. Say, oh, she now the any okay, now beat me out to us to the borderline. So, no, but at least reduce it to the minimum. Obibe say, oh, doctor, on a casa diet. Yeah, simple diet. Said, normally, would the bankuna with the 2 balls, who first diet, I'll be said, they say, best at 1. And they say, oh, if ye moody, I bank one the whole week. The first number say, okay, you be the once in a week. At least, just to control the consumption of oil. That's the only way I can advise. Thank you.
Dr. Mpacho, the question and the kind test edishesa kumana ye juma ye anase enye juma ye no. Maybe say BP machine check up no. And no quite enough to tell us say akuma no problem be any home. And now there is further test as I say ye to make sure say yankuma no problem be any way juma ye. Na tosu me no your baby na me hu say sudden lo be atwa hwe a eden na be ma hu say oni pay twa atwa hwe no cardiac arrest na say me hu signs say bi a bibi o ho a metumi aye aboa ansa na edo nipa no adu ayaresa bia na.
First question is say BP. You check BP, I know say UBP. That's all. Machine no I check on sana I check UBP down. That's not all. Akumane ye juma automatically akumane ye juma miensa at the same time to give you one end product. That's the BP. BP ni ye end product of akumane contraction. It is akumane pump here. The end result ni. But how does that BP comes about? That one you will not see unless you go in and do what we call the ECG. ECG nebeshe reading akumane de pompe emma osa BP no. Then you have to do the next one, the echocardiogram. That is to show how the heart is pumping to give you that BP. Because the BP, that is the end product of all the functions of the heart. So that's it. Inti ukone check BP ne ya me pacho ubenya kohwe wo ECG. At times ebinu wo hwa ye beka cho say BP no nkosro be ukoye ECG e hwe ECG na say nipa aye say wo BP but wo check wo BP no so you fine. Because one thing about BP no needs through all the time. Once in a while na wo BP kosro. And you say 24/7 no BP ni 180. No. I say what is it? Waves by the sea. Each wave has its own BP. Akumano one contraction bia with different BP are generated based on the demand and supply. Akumano only there say ubisana no abom mojana wa ma oche. So the demand will determine your BP at a particular time. Inti se mi tu America kohaba, mi BP be different from say meti hosia. And now say me da ho mi BP different say me transfer. all that has to be taken into consideration. Until one BP check, normal, doesn't mean you don't have BP. And one BP check that is high doesn't say you are hypertensive. Normally, I would like you to take the BP about 15 checks in different times so that I will know the average. If your average is above the normal or the average is within the normal. So my name is now could do one day, no drew no, me won't trust and I check yes, 180. And your demand and supply, you were walking. So you see about trust at least 5 minutes, rest, go and sit down again and check the BP. And they should check it 3 times. But at times, time new. Doctors say anytime. Nipa na egu hono doso. Wo ba inside no kro bi ka say doctor no wache. O kasa dodo nti ono so pese ofi ntem na to ba ye nya time and check it 3 times no. But wo ofie say na at least pharmacy bi ben and na say clinic kitwa bi ben wa utimi ko tra na wa bon komo kakra na check your BP. That will help you better than once in a BP check no. Now, what second question? That means you bet my ECG near echo to determine the blood pressure. Now, say you say nanka obi collapse. What do we do? Yes, obi feel ensure goodness. You know, normally that's what we do. Obi trashi hono na obi wohane asensio near their goodness. No, that is not it. Because you need the intra on your trashi. So in the church like this, okay, I'm a volunteer to St. John's Ambulance Service. We're supposed to be going around and supplying something for first aid almost in every church where there's gathering, and train 1 or 2 people who can do what we call the cardiac resuscitation. Obi yarino otrashi fompe. The first now we say, so say nipa no ohumi answer. 2 call to no one, no one saw home. Say nipa no home, that means obey here oxygen. 2, now the ones are ash and Nikon, I say, Nikon, a pompia and pompy. Say pompia, that means Akumana Ejai. The moment you say Akumana Ejai, a so start to say, Upushi Akumano. A be what woman first blow, say, I say to me, man, first blow. Man, Kessibo, and no kwa ye catch you see abrofo you see it transmits about 5 joules to the heart into a electrical activity a bit mama akumana ashasi now what start a pump akumano so one kwa there me pacho concentrate man kasa okoye no your friend say mouth to mouth no one man oxygen man you be say you pesa ade no wo dey compress the heart that one alone the chest as you are compressing the heart the chest will be expanding and closing. Meaning air may enter into your chest without you adding more. But then one will take care of the oxygen and the one will be compressing the heart. So you will have to compress the heart until you call an ambulance or somebody to help you. At times, with me, yes, you can save life. But ebeti obi trashi and only a few so near not to car taxi achi. Possibly can you pushing the chest, that will be the solution. But unfortunately, in a church like this, we should have some people who are trained to do that, so that in case it happens, then you have people to help you. Okay, thank you. Any more questions? Yeah, ma'am.
Pacho, my question view heartburns. You pass at such reading.
Okay. Info will come. Okay.
Doc Medasi. Me pacho. I say a briefing exercise. A yema heart. No me pese me bisa say is it true?
That one. Okay.
Pacho, sa cholesterol ya body cholesterol yi. Enuane bena e dis cholesterol ba. Ebi this year si wudi pa ya cholesterol be nya. yes we ya edi enuane pa and the cholesterol ba
Yo, you best start with breathing exercise. One of the main things, so unkwana wo na who say, I say wakuma na ye slower. The first thing I say, you say ubebowa. Now I started breathing exercise. That will help the heart because lungs, you know, ewo akuma na chain. Until expanding na squeeze say it helps the heart. So normally breathing exercise is good for the heart. But you will be more why or actual or more problem your friend is sleep apnea. Or da or intimi hume papa. Say Mosha, it been more da was I said some seconds. I saw on hume. All of a sudden wa was on hona was Sansha Sibu. Yeah, omuna yetro most of the time the breathing exercise. Say beya omunya apnea. Apnea say breathe or dahwa say been more actually. Say member now most more port belly most of the time ya de pa no or da na oshena I say some seconds oshena I say on humi all of a sudden na washa say no I started humi yes omu yes breathing exercise they should be doing it so that they can avoid sleep apnea and only almost solution. Inti ya wa we normal no in any other way to the heart. Your second question, heartburns. Heartburns, yeah, stomach problem. It has nothing to do with the heart. Most of the time, the acid in the stomach comes out in the chest. Then you feel it around the middle part of the chest. And because the heart is there, we all associate heartburns to the heart. Heartburn. But it actually is reflux. One thing is at times I'm on phone drink. So oh my come do too much. The acid alone can cause you problem. So what drink who actually say okay, it's a mupe will that meat we are that. But most of us will swallow it. When you swallow do you imagine how that meat dissolve? The acid in the stomach, if I take some and I put on here on the skin, the whole place will be gone. It will be bent. That is is worse than the car battery acid what is in the stomach. Because the acid is going to take care of that. So the vapor of that acid na emma or hard monoshishono. That means one, others say unidi regularly and now we did the 2. At times we might come to no work we did too much at the same time. We will say the whole day minute DNT or transit 2 o'clock. Adriana Odin from morning till into a basana the acid production will increase. Now we say your friend be a valve. There's one way verb. I be my diana form. But Emma e be masro. But vapor the oya denya e be basro enema e heartburns. 2. Yeah, e pay makobe brain also. And also one of the causes of heartburns. Nti say oh did also actually mako the only importance of pepper is to help you eat more. That's all. So udi aduane na anwa wo mo na person didi more na de mako aka ho ebe mo ultimate didi fine. That's the only benefit we know about pepper. There's nothing about pepper. Inti emayetimi didi more udi mako go aduane mo ultimate didi fine. Yeah, obi anim sir. That's why. But pepper has no any importance to the body. It just help you to eat more. So heartburns most of the time who did dear man not at the same time. Maybe did we no matter. No. Who did now that's how ubenya heartburns. You must sit up at least 30 minutes to 1 hour and sana what the whole. But most of the time you do fear your breath until you did we now you will get heartburns. And solution, who did the transfer for at least 1 hour, you will not get heartburns. Now a draw why you sorted that problem. Now cholesterol, yeah. Product a young one our body no more body the body is so smart. So in case the body uses sugar, the energy the body will get. So the body will use the sugar to produce fat, so that when he burns the fat, he get almost 10 times the energy he will get if he burns sugar. So even if you eat without eating oil, your body will produce oil, because the body consume more the energy in oil than. But the oil has two types. We have the good cholesterol and we have the bad cholesterol. The good cholesterol is the one the body needs to burn so that you can be active. The bad one is the one that is floating in the blood vessel. It's floating. Nobody is picking it up. I say, what did you na and one ensure na and one goso. Nobody is picking it, so it will stay on the wall. And that's the same thing that is going to happen. Into the bad cholesterol is going to stay on the wall, and then it will narrow the space for blood to flow. And then that's all that. Into a cholesterol. One, granules. In Katie, very good. Say you mununa, the fresh one. The two fumuna juice near milk and white. That's the best. Once it's toasted, that's heat. We have changed the cholesterol component in that oil to the bad one. And as I said, the nyasa ubinum your bottle or your office. Granite ya toast ya gum. Na ya wini kakra krasa. Yeah, actually we did a study in one of the banks, and one of the ladies sold these granules. So oba no abecha mo obia into obia the whole department. Obia cholesterol 8, 9. Almost someone say okay. Then let's find out what you eat. And we went, everybody is taking toasted granules. So in the office, yeah, that's it. So from there, they got to know that that's why their cholesterol is going up. That's one. And eating animal skin, according to people, it contains nothing. We know all the bad cholesterol in the human and animal kingdom is stored in the skin. Into okoto chicken cry say skin away. That's the essence, because that's where the bad cholesterol is stored. Into minim how I will lay there almost say I don't know, but it's still a skin, meaning at least there should be some bad cholesterol inside there. And the other thing we do is alcohol. When you are in church, you don't mention it because you know most people in the church will not be drinking. But one constant thing is alcohol. Alcohol is high concentrated carbohydrates, and is the end product of all the cholesterol you want. The 3 types in the body will be produced from this. And because they are producing it, they will produce both the good and the bad. So you are going to get the bad one. The good one will be used, but you are going to get the bad one that nobody is going to use, and that's what is going to cause you the harm. So if you can reduce your oil food, especially Ghana, red, 1, your granule soup, your palm soup, if you can reduce them, we are good to go. Repeat heating of the food. No, that is also no good. Any food that has oil that you heat and heat and heat, your cholesterol will go up. So that one too, we have to avoid it.
Papa Pacho, yeah, that's it. Pacho, last year, because yeah, surgery be okalebo, but me call surgical no. I'm checking me BP now. I'm to me call cardio. I also Mira or no say insurance in Yejuma. I work cardio because other department in na overcono first no baby say insurance when aye, but a what dear insurance in Yejuma, but echo ni ECG ni yes by BB the hotter ni na me yebi, but na me bisa doctor no ode me ye ECG no ode ba kona ase ekwan wuwom ba kon so na se ebobo ho ete mama ye bold bisa doctor ni say difference ben and a womb and o kire me say de ekwan ewuwo mu no ai say makoma no yama light off no na ebi akoma no still eye adwuma It's on the me for process ni mu nyinaa, but still me no ka say me gusu kɔ cardio. Me kɔ you see ama me 6 months me kɔ November. But ɔma ma me duro a me no. Ti me nkɔ so ano ma na say me de because me say ma brɛ mpɛ me ngyae kɔ.
So actually okohono say we are describing no and can't just say you free baby atrial fibrillation and can be sir. Okay, that means I say akumano BBC I very fast into what wakuma to me about 150 times instead of 80 in a minute. Into the only way we can slow down your heart are two things. Either say baho and come shock you. Always adding on movie near their ball chest near their mouth electric shock. That means we will stop the heart so that the heart will start afresh. But there's risks involved. If not that, then we'll give you a beta blocker. I'm sure either it be Bisoprolol or something like that, Carvedilol. These are the drugs that is going to slow down your heart rate. But the thing is, the day you stop, the heart will start running again. So that medication, actually what it does is that it controls all emotion effect on the heart. So Akumano responded to activities. Inti so we two America crana I say Akumano born 10. But I say what they a fast warrior. Inti you go too fast. Inti we need something to slow it down. Inti a drone there Unti binjai.
Doc, Pacho, follow up on that question. Then now, this 150 beats a minute.
A minute. Okay. So before I ever win, I say when you cry by 2 weeks, Nima maybe who's on Yemeno. Nakumano, you are setting up already. Now setting up Akumano or 3 major router or sending signals for the heart to pump. Yewoa ebeka 1 pair. The other 2 lines will be cut off. But it doesn't mean it doesn't exist. So anything that can stretch that lane will activate that path. So now for her, she will have possibly 2 lanes sending signals to the heart. So your heart will be beating. So the way you corner with the until I say nipa me no control no, he has to obey because there's a demand. So by so doing, if you come and we shock you, we try to stop one. In the normal sense, now the science have gone to say that we go inside the heart and burn that part of, so that we leave you with only 1 route, so that the heart will not be beating fast. But all of us have the 3 paths. We don't know when 2 will decide to start working. So when they start working, because we are not going to burn one, we say, okay, because at times we don't know which one is the good one. So I can go in and decide, okay, this one is not good. Let me cut it off. Possibly that's the one you depend on. So because I don't know which one is good, what I will do is that I will slow one down and make one to be dominant. So the medication is slowing one path, so that the main path, that is called the pacemaker, is the one controlling her heart. The day she will stop the medicine, the heart will start running again. Or at times, you stop the medicine, it doesn't happen until somebody provoke you and you get angry and the demand comes on the heart. Then the heart will remember, oh, I have 2 paths I can use. Then he set it up. That's it. So, Edrone there.
Yo, by
Yes.
We are coming home, you I come home and command ibiti. Now, me say, Akumano, I say, bunkum so. Now, ye nemuno. Mwadi bi woneti so. Say, udako ni fa. Akumano enye adwuma yi papa. Is udako bunkum. Na ye nemu so obi bitime butu ada ma ade achi. Obi bitime adaye ada ma ade achi. Na sa bunkum no ne emudie hin na ye da nankopa.
You see, at times, Dr. Google, ultimately confuse obia. In the normal sense, akumano eshe onuani sakn. Say with that upside down, with that anyhow, he has obviously a woneme kitem into the position doesn't change. Into that bonkumo, uda ni phone. but you were yarebi or wa eso that on bonkum and na whether nifa, especially if akumani intimi pompe wella. If the heart is not able to meet the demand, then it's better to lie on the left side because it permits blood to enter the heart without problem. But any problem there, that anyhow you are okay. It's just specific to those who have heart problem. Even more, only the right side of the heart is not working. If your right side of the heart is not working properly, then lying on the left side, it will not help you. It's better to lie on the right side so that the right will be free a little, so that the little he can do, at least it helps you. But most of the time, the doctor will advise you. If you depend on the doctor, he will say, lie flat with your face facing up. That one, neutral position. But the position as of now doesn't affect the heart in any way. Anyhow, you can sleep. You can sleep anyhow. The heart will be okay.
Me pacho me pese me bisa say, eden edi holding heart eba.
Okay, holding heart. You kind of a common thing because there are different type of holding heart. But normally holding heart, the time akumano e forming some signal from moving from A to B did not happen. And Yegusuka said most of the time before Mameno Bekasa onyemino na akumano de na wawie because akumani ni hwa ye hu se nipa wo yem. Yekoyeskana, the only thing that they are looking for is a heartbeat. And that means the heart is already formed. And when the heart is formed, it's not divided. It's one big sack. Then gradually it will be dividing into the left and the right. Okay. Then the whole thing heart during that time of division, a drobi or any quancy and during pregnancy. Possibly now unim krasa onim now fire. So it delayed the movement from cell A from that position to the next position. That will give you a holding heart. 2, so we are too young in life now, or we say only saying too early in life. Your chances that your child will be born with holding heart is high. 2, so we are obaso we need too much and son wa first born. The chances that your first son will have a holy heart is also high. So there are possibilities. Even more ewa busuanimu, say busuanimu be ewa holding heart. That means the chances that neba subenya holding heart is there. Inti ebinum so do ha just all of nowhere they were born with holding heart. But as of now, all holding heart can be fixed in Ghana. So there are doctors here who can go and fix all holding heart. So for us, holding heart is just know the holding heart. Let us have access to it. Let's fix it so that you'll be fine. And once they fix your holding heart, you are like any other person. People have gone to be doctors, lawyers, and they have operate them with holding heart. Some too operate their holding heart when they are 70-something years, because that's the time they discovered that they were born with holding heart. So they come and will fix it for them. So holding heart for us is not any big issue because it's just that it's expensive to fix holding heart. That's the only challenge. And health insurance doesn't cover cardiac, heart diseases. When they did it, we make a proposal and they did not accept it. We were supposed to be in the second phase or the third phase. That phase never came on because we told them that, you see, our patients are for life. They don't like patients that are for life. So somebody doing dialysis is also not on health insurance because that one too is for life. They want the malaria that will go away and it will not come again, the chest infection. But ours, once you have holding heart and will fix you, possibly we will see you till that kingdom come. Because usually you have to come for checkup. Let's see if everything is fine. If at times we'll close your holding heart and we'll create a holding heart for you. Because if we don't do that, the pressures in the heart will not balance. Because we are not, let me say, we are not God. We don't know the pressures. God calculated everything before they set your heart. So your heart is like this and you are living with it. All of a sudden somebody goes and change everything and you want the heart to be normal. Even if you have broken leg, you don't step on it for how many days? But the heart, once we finish operating, has to start beating and has to do the work like nothing has happened. So when we see that it will be difficult for the heart, we too will create a hole in heart as a valve. We call it like escape valve. We know that. So that if the heart is getting tired, he can use that mechanism to balance and be free. So we do all that. So you having hole in heart is, for us, is a mechanism for somebody to survive till he sees a doctor. It's not, to us, it's not any big thing. It's just a lot of money to fix it. That's all.
Papa doctor, that's it. Now can you say God has made us wonderfully complex. We are more 3 issues. We say more echo akumem. Ntimu twa ne kokwa na ntimu twa ne mfima na mu twa ne yem. The question back no. Number 2. Me ko mi fia me wo baabi a me fa na obi tumbrodo. Na musia ne brodo tun na enye gas de eye funo no kumon mi twiko mi yemu a e wo effect wo mi so ana ene ne de say cigarette nso ne twa to obi tu nkro no a me no obi nkro no kokoko twem na obi nso de kwa chese me ni obi koda akwantu mu no kwase ni me so na me hwe no na ade na ho me za me ka so obi wu pato kan wasem kire me tato say you know ana dabi enyo.
Okay. Normally, that's it. That's what we call the sleep apnea. We call it snoring. But most of the time, it's called sleep apnea. Now, there's a specialist for that has to sleep with a machine. Because what happened is that we have something that allow you to swallow so that when you are swallowing, nothing liquid can go through where you breathe. So there's a valve that separates your breathing from your swallowing. So when you are sleeping, that area become paralyzed. So it just drop. So the air is not able to go. So now you start making noise. So snoring is actually a noisy breathing, which most of the time we're supposed to fix it. But nobody want to fix it, because fixing it is to sleep with a CPAP, a machine that you put on your face so that it help you to breathe, because you are not breathing properly. And most of them will have hypertension. Yeah, most people who have that will have hypertension because it goes hand in hand. Because the breathing is not good. And it's actually, let's put it that, no, in the physiology, no. Until he just need to see respiratory physician, not on sorting it out. There are drugs for that. There are something for that. Some of them is allergy during sleep. Into both obey clear the throat the whole night. It's just because there's some dust he's allergic to. Oh, here, but unfortunately, the agent said obi snorer is normal, so nobody goes to see the specialist for that. Yeah. Most of the time, I can tell you, I've taken a patient to theater, and we discovered later that the problem is because he has sleep apnea. We went to theater because the heart was very slow. The heart rate was 22 in the middle of the night, around 2 a.m. So the father, the person's son is a doctor, so he called me. So we have to go and put in a pacemaker. And then in the night, because the father is dying, because heart rate of 22, you can't survive with that. So we put in a new machine that will help the heart to beat. So now this man walked with that. Then last about the first night in the hospital, they called me around the same time that my machine is not working because the man is not breathing. Then we went to the monitor, what we used to monitor the patient. Then we'll go through the records and we realize that no, almost around that same time, the heart do like is stopping because that time the oxygen content in the blood was around 80. But he was sleeping. He was sleeping, but his oxygen has dropped. Because of that, the heart has become slow. Because there's no oxygen for the heart. So if he continue like that, the heart will just stop. So at times, that's what happened. We just sleep and the heart just stop because we don't know what happened in between. And so if you see somebody snoring so loud, it's not bad. Just push him, let him turn on his side, and he will sleep better. He will breathe better and he will sleep better. And that will help him then continue disturbing you and you not sleeping and looking at him. And the other question is, how do we enter into the heart? Okay, so there are 3 ways we can enter through the heart. One, I can enter through the heart without opening anywhere. We'll go through the vessels. But the vessels come from the heart. So I have a cable or a catheter. I can pass it through and look on the screen and monitor it till it gets to the heart. So at times I'm going to do a procedure. I don't want to open the heart. So we'll go through that one. That is one mechanism. But what we do is open heart surgery. Meaning I have to open the heart. Cut it open here. So we open your chest like na ehu akoma no na afi ya manager adwuma ye na afi ya twa baby e pese ko ne twa wia ne ya sampa na the smoke. Okay, so actually say once say muko theater to say yeah theater say I can tell you that you can see even the smoke of cars in people's lungs, because if the smoke you breathe in is dust. It stays and it stains your lungs black. So normally, actually, if I was doing a proper presentation, I'll show you a smoke heart or lungs, how black it look like. So you can't take in. So you can't take in that. So that's why lately, if you know, even living in a dusty area, you're supposed to wear face masks. One of the reasons why we don't encourage transplant. You can't do transplant and live in Ghana because the place is too dusty. You're supposed to be wearing masks. And when you are wearing masks and you're walking here, everybody will look at you strange. So it's but if you can avoid the smoke, please use the face mask and you'll be better. No. And they're now cigarette, they all know they are now actually, there's a pathology that most of the cancers in this world is proven that cigarette smoking contributes to most of the cancers. 2, lung cancer is number 1. And lung cancer is one of the aggressive cancers you can think of. Once you get lung cancer, some of us will say, 6 months time, you'll be going. So we will just give you, at times you can go and take the whole lung out, but then the other lung, if it's also get infected, we can take one lung and you live with one. God being so great. At times you say, then you know my BBS spare pass. Because BBS my 2. Because you can see with one eye. But he gave us 2. Because he knows we will waste them. We will know you take good care of them. We will waste them. So the lung he gave us 2. The kidney he gave us 2. The only organ is the heart that we have only one. And that's the one we don't even, and he's the last one to get sick. Before the heart gets sick, that means everything that he has to do to keep you going has done and has failed. So we don't want the heart to get sick. I will not operate you when your heart is sick, because that means you don't have reserve. You will not come out. So I want the person who is fit. So at times some will come and doctor, no. That's the time. Because the person will be theater because you are fine and you have reserve. It's the reserve that brings you back to life. At times it's not our surgery. they said you the but that time depends on your own reserve. You need reserve there now asa.
Pampacho, Miami business akoma no minute ba ku bia as I say bo dudu ahia na.
As I bo dudu
ahia.
Okay. Minute ba ku bia. Yeah.
Send your air buffer no. Pampacho ye pese ehun se bia e kosusu. Minimum te se pause no ni.
Pause.
Pampacho ye hu se ahia na ye ko na wo chro wa ye bebisa ho asem se. As I say bo ahia.
Your pulse there between 60 to 90 is good. Even maximum 100. Okay, now pulse 100 it's fast, but it's okay. But okay, 120, 130 is too fast. You are not running, because those who are running is demand, so they would need more heartbeats. But if you are walking, you shouldn't, and it shouldn't be too low, below 60. When you go below 60, we start observing it. But when you go below 50, you need a pacemaker. You need a machine to start running the heart for you. That means you can't run your heart by yourself. And that pacemaker is expensive. But a lot of people have it. And actually, pacemakers are old age problem. Cables now, I can want some say it me money fasting. So that means your heart is going to be slow. So I have to rewire the heart. Yeah, then we put in another cable inside the heart and connect it to a machine, then you are fine.
Doc, that's it. I count 5 minutes.
Okay.
Now maybe some question. Pacho, obi woha kakrana ni buefu. Kakrana ni buefu. Kakrana ni buefu. Etumi mo nya akoma yare ana.
That's the worst part. Anger. One of the worst things for the heart is anger. Once you are angry, all your muscles need blood, the brain need blood. So it's the demand on the heart goes higher up. That's why at times we give you some medicine. You know, most male, when they come and they have pressure, they don't like our medicines. Most of them don't like the medicine. But there's medicine that we use because we want to control the way you control your heart. So we give you something called a beta blocker. Beta blocker is block all emotions affecting the heart. So that when you get angry, it doesn't affect the heart. So that the heart will be on count. But normally when you get angry, your heart starts beating very fast. So we give you a medicine to control that. And that medicine control all your emotions. Meaning all your emotions. That's why men don't like that. Because all emotions are going to be cut off. So most of the time, because that is how we do it. So when you come and you talk to us and we realize that your way of BP is because you get angry, you are the one who has so much stress and everybody is stressing you, they will push that medicine inside it for you. So that we want the heart to be fine. The other one is not essential. We call it not essential thing. So we don't mind. We can close that thing for you. Okay. Yo, yes, say me tamaso. Okay. We there, madam nyina ase. Ana, question bi o.
Also yes, say me fa say my exercise and I'm dimika me be do a me num nso a nyese me num no gran me num ne kakra nyesa e be affect makoma.
Actually e be trauma e affect akoma no per se. Okay. A bit trauma because the muscle that you are using to swallow was not part of the exercise. Oh, yes, exercise no wada. All of a sudden, because we are brain tea or non sorry no onion intent to send out to American, it can't do. You see, the body is said that we treat it with. As Obi say, you taking care of the body. Till so, work you be our brain speed. There be or no count. Possibly or no, that time the esophagus is closed. All of a sudden, a gallon in a minute on to me. So you take your time, you sip water, we sip water. But Ghana you're penitent. Okay.
Okay.
It's not just the heart, but it will go to the lungs. That's all.
My last question is say we say you are month bia no yenko na yenko check yakoma no.
Every year. What we find to say we say.
Yeah. Intini yenko check intino me bisa say e betima ba se meko check. Bibia e correct kama. Ba maybe ameba bedu fie e bia nwumre no. Akoma no betima sa anya problem bia na.
Yes.
Na edin na se me hu o me nipadua mu a se me hu se no. Die ekoso die me hu ne se makoma no. Problem bi na eba ho.
Okay, so time bia me issue amount for more fridge of fear no. Omoto fridge guard say bia say power fluctuation but obi anim time power no be change. Yes sir. Enso ye nyina obi ato ni fridge pe no ato bi aka ho because you want to protect the machine. The same thing the heart. Even when you say you have palpitation, the palpitation is not every day. Into halter, that machine every halter. Yeah, the ball home for 24 hours. 24 hours, that palpitation na ma. Yeah, and don't just say palpitation anyhow. Because doctor knew who you know, and don't just say anyhow. Most of the time, we take you very serious. Obana kase, wakuma tiseya. We want to go to the bottom of it because when our failing now so wakuma. Normally, the first thing akuma no chese wa brain is say, "Onantika krebia no abre." And now you be big to ebia no abre. And no chese akuma no obre. That's the first thing. Yes, I want to me home. So we be so me nante ko habasi na ma bre. But first nante sa and it chese akuma no obre because on me ma demand ni supply no it doesn't match. 2. So wo be a bibi kitu abi as you say bibi kitu abi na obofu. Bibi kitu abi na akuma no eco speed. And it just said no akuma no in the normal sense and you're fine. Because yes I no be a react. Normally be a yakasa will be a ton of bed. Hey, that means akumano and you're fine. One of the common symptoms is headaches. Uchi pa will be a pacho check BP shake. Because that's one of the common things. HSA BP no was true. That's the only thing. The last one say ubenya stroke. Na stroke so de unya obi say yade no eko unyanya ba untimi nya hwum hwe. Okay. Yo say no. Okay, so we there, Madam Ase say mwaye aso e dey ama me. Thank you.
Yeda do kwase. Ti pacho ye bebo afore ye. Ti ye be free verses for no my dear ni abo afore.